Welcome home to USA Global TV and Radio. Ours is a place where dreams take flight, voices are heard, and stories are shared. This is where cultures meet, connections are formed, and ideas are transformed into action. This is your destination for authentic storytelling, diverse perspectives, and meaningful conversations. We're where global stories unite and bridges are built beyond all borders. Discover our world of education, entertainment, hope, and inspiration. Together, we're building bridges worldwide. Subscribe to our USA Global TV channel and download our USA Global TV app. Be our guest or join our team. Visit usaglobaltv.com. With heartfelt thanks to our executive producer, Dr. Jacqueline Kerbeck, music scored by Yifei Tang from Cloud Road Music, creative direction by Paul Garcia, and I'm Al Cini, and I'm very proud to be part of the USA Global TV and Radio family. So join us here at USA Global TV and Radio. Make us your home for global connection. All rights reserved. This video and its contents are the exclusive property of USA Global TV and Radio. Unauthorized use, duplication, or redistribution in any form is strictly prohibited. Thank you for being a part of our global community. Let's inspire together.
Hi, everyone. Welcome back to the show. And yes, let's inspire together. I love that phrase. I'm Dr. Danielle Lord. I'm the hostess of the Compassion Project, where we talk about how the state of the world, there is trauma all around us, and we have to be able to recognize it, call it out in order to move beyond it. And that begins with us. In taking care of ourselves, making sure that we are giving ourselves the self-compassion that we need to move through the trauma that exists. You know, one thing that I like to remind folks is that most of us think of trauma as an event, a car accident, a building falling down around us, something that is a life-changing watershed moment. But actually, there's something called level 2 trauma, and that is what we refer to as kind of daily or repeated incidents of interpersonal attacks. And I think that this is really what I refer to when I talk about institutionalized trauma, and that it is all around us. One place where trauma really exists is within the healthcare realm. And we've talked a little bit about this and had some previous guests on who have shared their experiences. And today I'm bringing back a guest and actually a colleague of mine, MICHON GAREMANI. And MICHON is going to talk to us about her experience in the healthcare sector. And MICHON has an interesting experience and take on this because MICHON herself is a trauma coach. And now she has revealed to her a whole new world of what happens within healthcare and once you enter into the healthcare system. So welcome back to the show, MICHON. Happy to have you here again. It's been a while, probably a year.
Yeah, at least several months. So thank you, Danielle. I appreciate the welcome back. I appreciate being able to connect to your audience. I appreciate the invite to share my personal experience in this dual role. I have a professional role and then I have a personal role. So as a professional, I work in trauma recovery. I work as a certified hypnotherapist, and I work specifically with a program that I've built to help people mitigate and manage those symptoms of trauma. And I do that by allowing an interaction between myself and a client. And through that interaction, we rehearse a new skill set, a new frame of mind, a new set of strategies. And boy, oh boy, has that come to play as I myself have had to adopt and make use of those in a practical, everyday sense as I have become a new caregiver. So my caregiving role started earlier this year, and it was really a surprise to me stepping into that role. But it's been a journey that I've embraced. It's been a journey with a few tears, as most of us probably can understand that. As a trauma recovery coach, I have given greater care to my own involvement in this, as in my own needs have stepped to the forefront so that I can be equipped to assist in a caregiving role. So this duality, right? Always in action.
Yeah, you have definitely a unique skill set that most people probably do not have. And so there's a couple things that I want to unpack around that. And one is that oftentimes we find ourselves in a situation of this kind of level 2 trauma, right? Where we suddenly something has landed in our lap. We didn't anticipate it coming about. And here it is, all of a sudden we're caring for somebody through an event that might have been a traumatic event for them, right? And then suddenly we find ourselves in this place of caring. We oftentimes don't realize that that is trauma that's been inflicted upon us. And so we start to just kind of go through the motions, right? Without realizing actually the fatigue that we're experiencing and the frustration, the stress, the anxiety. We just don't function at our best that way, right? I always say the stressed, tired, frustrated, anxious brain just does not work.
Yes.
I think this is what happens a lot of times, is that people just suddenly find themselves in this, and it's maybe 6 or 8 months later when they're like, why am I such a hot mess, right? Why am I so not being able to function? So, but you had a different skill set. Did you find yourself, was there a point when it was like somebody ripped the Band-Aid off and it was like, oh my gosh, I'm here, I'm in it?
It kind of began, the feeling for me was really a kind of a gradual onset. I mean, in my case, this was a medical situation where there became a new medical need. And so with that, everyone's dynamic will be different. The story that leads them into trauma, or the trauma story itself, is a little different. For me, it's a family member, a caregiving need for a family member. And this was kind of a forecasted surgery. We knew the surgery was coming, but the way it played out is what is really, pardon me, the unfolding of that is really what's unexpected. And the hoops and the this and the all the different aspects that I was unaware of on the medical side, on the financial side, on the actual hospitalization side, or the caregiving side, the skilled nursing facility side, all of these parts. And then there's my family. Getting our family involved, getting a particular family member at this journey, at this place in the journey, or a new family member to take over this unique piece. It's been a whirlwind of orchestrating all of these different things. I've shed some personal tears over the empathy I have toward my family member and the situation that they're experiencing, because I'm having my own first-hand experience, but I'm not the one in the medical need. So it's been such a unique adventure, and I call it an adventure because I think labeling things positively is where I really want to be moving. My mindset is that this has been an adventure because I've learned a whole host of things about my real skill set. What do I really call as I own as a skill set? What do I really believe about life after death? Right? Because some of these things have come up. There's risk of passing during surgery or risk of stroke. There's all kinds of, right? So I've learned a little bit about my own belief system. I've learned about the capabilities and capacities of my family members. I've learned about the role of the medical field and what they will and will not do for you. And you're on your own and not much advice. So it's been a really interesting journey. No,
I can only imagine. But what you touched on was really about having an open or positive mindset around all of this, right? And imagine if you didn't have the capacity to have that positive mindset, how much more painful this entire event or situation could be.
Right.
Talk a little bit about mindset and the power of mindset and the work that you do.
Wow. We hear a lot about it, and it's quite cliche. I think today, the mindset, we have to have positive mindset. And there is a lot of that. There's a lot of truth in this. And the real reason that this is positive for us to move into positive thinking is because we are hardwired into a negativity bias. And science has talked about this extensively. You can research this negativity bias. And the negativity bias keeps us alert and poised for threat, because I have to remember what has been difficult before so that I purposefully don't move myself into spaces that challenge me in those safety wise. But positive mindset is more than just happy thinking. Positive mindset isn't just a happy thought, like I am loved. That is wonderful to know that you're loved, or even have self-love. But a positive mindset encompasses, I think, a host of our value system, the actual real tangible social network that you have, and the skills that you utilize to ensure your sanity on a day-to-day basis. So positive mindset, and that's just a few that kind of make up the ingredients of a positive mindset. I have a routine and a habit of certain things happening on certain days in my life that I structure into my day, my time and day, because I need them. It's for no one else. Now, people benefit from what that does for me, but it is strictly for me. And it is not selfish to endeavor time for myself, or to endeavor new learning, or I simply just need to take time out, go to bed early, sleep, stay in bed a whole day. If I've done that on occasion because of exhaustion, or the stimuli, I'm overstimulated. There's a whole host of things that go into a positive mindset. That's just a few.
Yeah, I appreciate that. I think you're right. I think it's kind of become a cliche thing at this point, right? Where there's so much more that goes into it. But you really touched on this need for self-care. And I think we oftentimes see that as being selfish, right? Well, you're just, or checked out, or given some other label around it, like, oh, so-and-so must be depressed because they're just kind of spending a day having a self-care day, or whatever the case. So I think it really highlights how important it is. So something that you were talking about that made me think about an experience that you and I shared related to my own, my mom having to have surgery. So my mom had there's the hepatic system. She had a 20 centimeter mass in her bile duct, which then made half of her liver become necrotic. And so she had to have a large portion of her liver removed, which is amazing because the liver grows back. So, which is the only organ that grows back. But MICHON helped my mom make sure that she had a positive experience in the OR suite. So talk a little bit about that. I think this is probably something that a lot of folks do not know about, the trauma that can occur when you think you're under anesthesia, right? But actually the brain is still very active.
Yes,
so share a little bit about that. And then I want to hear more about your story.
Yeah. So working with your mother, that was a really wonderful and tender experience. Remember, one of the things I think our culture really lacks is this emphasis that I am a person and you are a person and we can meet eye to eye. We don't have to have much common ground, really, but I can see you as a tender individual who has afflictions and heartache and love and grief. And that is how I meet your mom and I meet my clients, because somewhere in their journey, there has been a misstep in some of those things. So that's a first great need for a connection there. That also builds trust. I see you as an individual. So stepping in to work with your mother in a medical need, there's already a high level of apprehension to step into a medical procedure. And so we don't need anybody else adding to that kind of apprehension or fear-based proceeding. So I worked with her in a state of hypnosis to prepare her for her surgery, to prepare her mind to embrace the experience of health and journey, that like, why are we doing this? Because this is betterment of your health overall. Also to keep in mind that the mind does stay open and intaking all information that is transpiring around us when we are not conscious to us. So even in sleep and hypnosis have some similarities. I may know my body during sleep notices, unaware to my cognition, that I may be hot, so I shed my covers, and I don't consciously know that, right? Hypnosis is somewhat the same thing. So in some realm, the body in a procedure under the hands of a medical team in a medical environment, there's medical talk going on. There's the sound of alarms or bells or medical equipment moving. There's dialogue between physicians and other caretakers. That is all received by the brain and stored as an experience. So I prepared her to instruct her medical team to be kind and courteous and cautious of the talk that goes on in that space, and to prepare her mind to either receive what is positive or dismiss what may be negative that turns up. So we can prepare the mind in a state of hypnosis to really receive all that is bountiful, all that is good in those environments, and do it at a subconscious level. See, and that's where the power of hypnosis is really at play, is creating a mental funnel, if you will, for all that we want and all that we good, and it funnels out the things that we don't. And we understand that in the state of hypnosis, we can really look at the emphasis. Where do we want the emphasis? And get the mind to really pay attention to that new story that we're looking for. I want a state of health as the outcome of this procedure. I'm going to live in vitality as the outcome of this procedure. My physicians are well equipped and they understand the care and love I deserve as a human. I'm not a specimen in this exercise, right? Mm-hmm. So this kind of dialogue, preparing her mind. And the outcomes she wrote back to me as a review and in conversation that it was just a wow experience for her, and that she's been able to receive the kind of care she needed. But the hypnosis really added to her experience of positivity and gain. It wasn't just that she had a good surgery. There's even stacked upon that more reasons that it was a good surgery.
Yeah, with the beneficial outcome. Yeah, most folks don't realize what goes on in an OR suite during the surgery. Sometimes there's throwing and yelling and screaming, so it can be a little bit of a ruckus environment. So yeah, thank you again for helping my mom through that journey, and I hope this gives folks that may be listening now or in the future an idea of the work and how powerful it is. The mind really is a very powerful thing. But one thing that now I've spent 30 years working in healthcare. So while I still don't understand all the ins and outs of it, right? I'm a doctor, but I'm not a physician. There's a lot of complexity that's built into a system that has just compounded in complexity. And probably at some point over time, that system is going to implode on itself because it's so heavy and complicated. And oftentimes individuals who haven't experienced a lot in healthcare understand the complexity of it around the billing and the coding and the lab tests and everything that's done out of the need for compliance, for quality, for to maintain good care, and also sadly the financial aspect around that. It adds complexity that the patients and the patient family members just oftentimes don't understand. And I think in your journey with your loved one, you've experienced some of those that have certainly been the trauma that you've experienced. And I always like to say that anything in healthcare, in my humble opinion, is either a pain or a humiliation ritual. That's me.
I've seen that.
Yeah. So share a little bit about that experience, because I think a lot of people go in thinking it's just going to be a simple surgery. And yet they find themselves 6 months later still kind of dealing with the frustration, the angst, the bills.
Right. Well, let's start what I'm going to call the start, because there's always a consultation of, hey, I'm having this problem. What do we think is best for a remedy, right? As a patient, I come in and I have a problem. I present my symptoms or my experience. But a physician often will present a timeline of, oh, yeah, we're going to do this. We could try this first, and then we try the second. And if nothing works, then we go this route, right? I want to say I'm grateful for my mother's physician team, because they've been very communicative and very forthright with the risks and the possibilities of failure or success. But I will say no one ever has gotten it right of the time it will take for things to take place. How long is this recovery going to last? 6 months? Nope. It's at least a year for certain surgeries, right? There's ramifications upon other body systems as well that I don't feel like gets talked about. So when you undergo a surgery or induced state of medical care of your own will, or there's a real trauma like a car accident, now you're thrust into medical care. Those kinds of things are really important for family members to understand the longevity of this experience, because it offsets many of our own lives, or it introduces a new timeline for us that we have to adjust or shift to. Work, we're shifting. Money, we have to shift. We have to shift our time. Certainly our heart space gets, a ripple effect. But I think in the medical field, collectively, what I've seen is that there's a misrepresentation, an underplay of what it really does take. And so my advice to anybody out there is double anything, double the length of time of recovery. And that isn't to make us be like, oh, well, then I don't want to do it. Or why would I want to do that if that's the kind of time it takes? Look, the time is going to pass anyways. We either can pass with help and a team of medical professionals that really want our betterment, or we can pass continued in a state of digression or health, right? Degrading health. Time is going to pass. But I think to misrepresent it offsets a lot of people's lives. So that's one takeaway that I feel personal too. My mother also had a very unique experience with this last surgery where we knew it would be a 2-part surgery, one part to do certain things and a second part to do another. Without the details, I'll just leave it at that. But to schedule this second surgery, she had some complications with her biometrics, and we needed to get some things in check with her health and some biomarker levels. And it's prolonged the second surgery, which has taken a toll on all of us of like extended care, finances. It's even taken its toll over the summer months, which people have vacations planned. So who steps in because I'm not canceling that reunion that's been on the calendar for a year, So there's so much at work here. Hopefully some of that resonates with the audience, that these are things that are unexpected. And that's another thing. Expect the unexpected, but that list is huge, right? What could be unexpected?
Right.
Unknown list. It's been a crazy journey. I have to say, though, kudos to my family. We've stepped up to the plate. It's been healing work for us as siblings as well. And some of our true colors have come out in full force, not necessarily lovely ways, but we're learning this new dynamic together. And I have a family that I think that I'm grateful to say we really do work together to try and have us be cohesive and on point together. And we're working for the same things. So
but that right there is huge because I have seen many, many times when the families are not getting along, and then it's just one more added layer of complexity and that trauma that comes along with it.
And trauma of any nature can create fractures in a family that were not fractured before, or even
deepen existing fractures, I'm sure.
Or even like create severing, not just fracturing. Right? Traumas are really impactful, and we have each of one of my siblings and I have a firsthand experience in a very unique lens, and so all of it's to be accounted for as a very unique experience. None of it should be discounted. Even the surgeon who does this repeated surgery, or who is coming back to do a repeated surgery, they have their own firsthand experience. And I've seen a humbling in this surgeon, Dr. Chen. He's been really a wonderful guide, but a confidant. He understands the tears. He's shed some tears with us because he understands the complexity of this and the risks. It's been tender. I would say those are some of the really highlights that come out of it that have been really good. Some of what's gone wrong is relative. That's my own evaluation. Timeline, again, it's taken much more time, much more money, much more strategizing of time. And some of those have been challenging to work with. Yeah.
Mm-hmm. Yeah. In a system that's really not designed to work with you. It's designed to protect itself, right?
Yeah, because everything's
and usually that's the answer.
Yeah, it's insurance-based. What will be covered? Can we get this approved, this approved, this approved? I have a sibling who is doing a Family Medical Leave Act to be participating in this next set of timeline. And the hoops that has meant for her and her employment side, also getting documents to the physician and coordinating physician timeliness. These, physicians are busy. So, but these other things are also important because your employer has a timeline and trying to structure all those things together, right? It's not like we're dilly-dallying over here and twiddling our thumbs. We're trying to get stuff done.
It's again, in a complicated system that is not designed for the patient or the patient family in mind, for sure. So one thing, MICHON and I actually connected through caregiver trauma. In that we know it's called compassion fatigue, of course, burnout, PTSD. I put that under an umbrella of a term that I've developed called cumulative workplace distress. So that includes things like all of that I mentioned before: burnout, compassion fatigue, even PTSD and moral injury, all fall under that umbrella term, cumulative workplace distress. So MICHON and I got connected because MICHON was a trauma coach and because I wanted to put together some kind of support or resource. I hate to call it a support group, a resource functionality, if you will. I still don't have a good word for it, that supports caregivers in this journey. And so MICHON kind of came at this without any real experience in healthcare. So what have you found, MICHON, as you think about all of those things that the caregivers experience in doing the work? What have you discovered as kind of part of this journey? Have you seen the compassion fatigue, the burnout, the moral injury? And I think that this is becoming really prevalent right now. So what have you noticed?
Yes, I have. I have to say, gratefully, it's been limited, but I have seen it. I've seen it in the skilled nursing facility side. My mother has a very unique experience, and the caretakers at her first skilled facility were abrupt. Some, this is not all, right? Some were abrupt to working on autopilot, like, oh, you just had surgery on your hip, so we got to get you out of bed and get you walking, get you moving. Well, that's not going to take place. She has a non-weight bearing command from the physician. And so, it begs the question, do these employees, the staff, the skilled nursing staff, are they even informed of the depth or scope of the patient before they enter a room? What protocols are enforced by the employer in their role to understand the patient concern before they even step in with, let's try this, let's do this, or why aren't you already there at that stage? The first and foremost, you've got to know your audience. I have said this until I put the face. This phrase applies across the board everywhere, at the grocery store, at the doctor's office, at my bank. You got to know your audience. Does that person even want to talk? Do they give you the vibe that they're interested in opening up, right? We got to really hone this skill. And I think especially as a skilled nursing facility employee, that has to be really at the forefront. So know your audience. So without any asking of the questions to my mother as her her physical abilities? What's her pain level? Pain is a big driving force there too. What's my mental state to even want to heal? Do I even want to heal? Right? Because the mind drives the body. You got to check in before you start making commands or demands. So I saw some of that I saw some verbiage that I was like, you don't get to talk to my mother that way. No, I'm standing right here. You don't get to speak that way. What's going on? Like I've actually had to say to somebody, you need to leave. You need to exit the room and go get yourself collected. Like that's what you need to go do because you're not functioning at what is needed here. I've had to call people out on that. I've seen it across the board in other things too, but and then I'm not trying to give skilled nursing a bad rap. There's plenty of training, plenty of good people. It is just that I've had some of that as an experience, lived experience, and it's real. So for those that may be headed that direction, needing that kind of offset care that isn't your family, you can trust your family to hopefully trust your family to give you the more tender care, right? That tenderness. But there is an objective over at a skilled facility. You are a patient in a bed. That bed has a price tag. How long you stay here, right? So I know that's working on a script in somebody else's mind, but it's not working in mine. I'm here to help my mother get what she needs. You're here to earn a paycheck or bump a bed, get the next person in because their insurance is higher and will pay more. I don't know.
Yes.
I speculate. But those are some of the field essences behind some of what I've seen. Yeah.
Yeah, those are actually very real things that occur in actually in hospitals as well. Certainly have seen that as well, but definitely in the post-acute and the long-term care world, it's how soon can we get the bed filled?
Yep.
And that's a tough thing to hear when you're working in that space is, oh, that patient just died. How soon can you get the bed filled? And the first time you hear that, actually, hopefully, the feeling of, oh my gosh, what did I just experience? Hopefully that never goes away. But I think that's part of the cumulative workplace distress, right? Is that eventually I'm going to hear that statement and know that this is my job, is to fill the bed. And that's how we end up in this space of kind of, institutionalized trauma where everyone just feels complacent and apathetic to it. So it's definitely a very real thing.
And having that statement be the driver of our behavior is a miss. Now, it may be a factor of your employee, but it is a miss that sits at the forefront. I will tell you. If we are going to have businesses title themselves with acute care, the word is care, right? Then we need to be seeing that.
Yeah. And, I tell people regularly that just because you've entered the healthcare system where you think you have caregivers and nurses, there is no compassion that's guaranteed in that space. So one thing we have just a couple minutes left, and I want to make sure that folks, one, know how to find you, but I'd also like folks to know about Compass, which is our joint venture that we are both co-founders of Compass. So before we dive into that, and I'll give our producer, Dr. Jacqueline, a second to pull up that site as well. Tell folks how they can find you, MICHON.
Wonderful. Thank you. So this Danielle, I'll let you speak to this. This is your Archetype Learning Solutions site where we have co-hosted Compass. This is where Compass is here. So I'll let Danielle, I'll turn it back to you. Let you speak about that. Yeah.
Right now Compass lives on my Archetype site while we figure out a domain name and all of that. But our whole point in doing this was to provide caregivers with the opportunity to have complimentary or free tools and resources to help them move through some of their cumulative workplace distress a little bit easier. So we host a variety of tools. These are some of the coaches that we work with as well. And a couple of them have actually been on the show, The Compassion Project. And so these are coaches that caregivers can connect with. If they want to connect with someone, they certainly can. Otherwise, we've got lots of tools and resources. We just opened up a group. so you can kind of jump into a group and connect with folks and gain more peer-to-peer supports. And then I'm going to start an administrator corner so that administrators have a place to come and get tools and resources that they need so that they can help engage their teams a little bit better and hopefully help them move through some of the compassion fatigue that they're experiencing. So that's our Compass site. And so if you are a caregiver, we're primarily targeting the post-acute and the long-term care side, but we also know that individual caregivers like yourself, MICHON, what you're experiencing, they are very desperate for resources. So if you are an individual caregiver, suddenly finding yourself caring for mom or a spouse, I know that these tools and resources are here for you as well. And unless you contract directly with a coach, all of the resources and tools that we have here are completely free for caregivers.
Yeah.
So.
I love that. I love that Compass is offering these free resources. So Danielle and I have orchestrated a collaboration of minds, really because we see the need. We see this need and we want resources in the hands, practical skill set building, real tools that are going to help and mitigate some of that stress and fatigue. We've put that together as a free base, I think you've got 15 tools or somewhere in the vicinity of 15 different tools.
Somewhere in there, yeah. I
like
really loaded up in July.
Yeah. So what's really great about that is that those are all free resources. Now, should you want an extension of those or a more personalized experience in one arena or another, you can reach to those other coaches that are shown on the site using their bio information and click into theirs. And any of us will be able to contract with you personally and directly. And then you would be able to work on an extended basis with that individual. So free resources with the potential of long-term care should you desire that. So that's really an avenue of care for people that maybe not know about it, right? So we want people to know about this.
And I would add to that too, that MICHON and I have been very intentional in making sure that this is non-allopathic care, or what we call traditional Western medicine. So there is no one who's going to hand you a script for more benzodiazepines or anti-anxiety meds. There's no one who's going to say, let's continue this conversation for 3 years. This is non-traditional ways of healing that we don't normally see in healthcare, because my very personal opinion, I think healthcare is very broken. So with that, MICHON, how can folks find you? How can folks get a hold of you directly if they choose to not go through the Compass site?
Right. So I have my own website. This is Rooted to Rise is my business. I have a LinkedIn profile here. Rooted to Rise is my company name, Rooted to Rise Coaching. Thank you. Thank you, Jacqueline. This is my site here. And I offer hypnosis services, emotional recovery, which is the trauma recovery. And I also offer a product called the Bach Flower Essences. They're for energetic healing. So my services cover the gamut of trauma care. And I haven't encountered any form of trauma that hypnosis isn't applicable for, and or skill set. I stepped into the realm of teaching, learning hypnosis and then using hypnosis with clients because it moves into the subconscious space and can really get to the origin story of the why. We are always presented with symptoms, and then we can look at those symptoms like weight gain or excessive rumination, right? Rumination, or just any kind of bad habit, if you will, and hypnosis can work on remedying those things. I work in the arena of grief, stress reduction, anger management. This is the gamut of people of all ages I've worked with, as young as 6 and as old as in the 70s. I don't really ask people their age when they're in that kind of age bracket.
Excellent. Thank you, MICHON. So we have just a few seconds left. So I just really want to thank you for being part of the show today, sharing your journey and hopefully helping people understand that when they enter the healthcare system, you have entered an entirely new world, and it can be very taxing. information is key, and hopefully this will help some folks prepare themselves as they enter into this space of trauma. So thank you again for everyone. Really enjoyed having MICHON with us today, and I hope to see you back in August where we're going to have a great panel. So thank you so much to USA Global TV and to our producer, Dr. Jacqueline. Bye, everyone.
USA Global TV and Radio proudly presents Tracy Cram-Perkins, a dementia caregiving survivor teaching how to balance care with peace of mind. #1 resource for dementia caregivers. It's the book Dementia Home Care: How to Prepare Before, During, and After. Over 17,000 copies sold of this must-have guide. And now a testimonial from Tracy Smith.
If I was to describe this book to someone who is going through a similar situation, I would underscore how important it is to have some sort of a tool or a guidebook to help you through certain stages. And there's so many, it's such an unknown topic to the average person. And to have this as a reference is essential. It's going to help you get through it personally, as well as help your loved one manage.
To learn more, go to TracyCramPerkins.com. Tracy Cram-Perkins is an award-winning author. She's also the host of Dementia Home Care television show. Watch it here on USA Global TV and Radio.
Get ready to wear the brand that's changing the world of media. Introducing the official USA Global TV and Radio online store. From our TV show hosts to our incredible global guests, you asked, we delivered. Rep your appearance with pride. Whether you've been on air, hosted a show, or tuned in, we have something just for you. Visit us at usaglobaltvradiosshop.myspreadshop.com and start shopping today. Check back frequently. We're dropping fresh new designs all the time. Showcase your role in our global community. These designs celebrate your voice, your story, your presence. It's more than just merchandise. It's a movement of hope, inspiration, education, and elevated listening. Head to usaglobaltvradiosshop.myspreadshop.com. Your spotlight awaits. USA Global TV and Radio. Elevate your style. Elevate the world.
From the magical world of the amazing adventures of Lady Ella comes a heartwarming new journey filled with kindness, courage, and compassion. Lady Ella, the beloved ladybug and listening mentor, is back, and this time she is not alone. Meet her brave and thoughtful brother, Lord Jack. Together, they take flight on their very first kindness adventure. Along the way, they meet 3 new friends in need: a duck feeling discouraged, a mouse struggling to be understood, and a busy little bee who's completely lost. But with the power of elevated listening and simple acts of kindness, Lady Ella and Lord Jack show us how understanding and empathy can make the biggest difference in someone's day. Written by Dr. Jacqueline Kerbeck, the listening mentor, this 9th book in the best-selling Lady Ella series teaches children ages 5 to 10 the essential skills of listening, kindness, and etiquette. Now available for pre-order on Amazon. Scan the QR code and order your copy today.
Thank you, viewers and listeners of USA Global TV and Radio, for joining us today. We're honoured to have your time and attention as part of our global community. At USA Global TV and Radio, we believe in the power of authentic conversations, meaningful connections, and creating a world of possibilities together. Want to be part of something bigger? Join our team of elevated listeners at usaglobaltv.com, a space where your voice matters and your ability to listen transforms relationships. Stay connected with us across all our platforms for thought-provoking discussions, expert insights, and empowering stories. Subscribe to our channels at youtube.com/c/USA Global TV. follow us on social media and explore the endless opportunities we're creating for growth, learning and inspiration. Together, we're not just broadcasting, we're building bridges and changing lives one conversation at a time. For inquiries, contact us at info@usaglobaltv.com. Music by Johnny Dyes. Produced by Executive Producer and Director Dr. Jacqueline Kerbeck. Voiceover by Mike Porter. Creative Direction by Paul Garcia. All rights reserved. Copyright 2025. Visit usaglobaltv.com to view our full terms and conditions.